Hi, my name is Melanie Weller. I'm a physical therapist, and I'm going to talk to you today about activating your vagus nerve. And vagus nerve is really important to your overall health because it mediates a lot of different things. And one of the real limiting factors in people recovering from various health issues is that they and their doctors and family members and people around them, they all get very much either addicted to being right about what's going on or addicted to being wrong about what's going on, or they are not, they don't know how much power they have in finding a solution. In the research, when somebody, like when they give subjects a painful stimulus and they tell them that the answer, they give them a keyboard and tell them that the answer is on the keyboard, that just that knowing that the answer is on the keyboard, part of knowing that there's an answer there helps to decrease pain. It activates part of the brain that decrease pain. So understanding that there's a possible answer is really part of it. And your vagus nerve, a lot of things get better when you improve your vagus nerve health. Mindfulness and meditation practice have been shown to improve vagus nerve tone. Neurosurgeons will implant a vagus nerve stimulator in patients that are having seizure disorders and chronic pain issues, among other things. And so, but there's not very much offered to people that's in between there. And there's a lot you can do to improve your vagus nerve health. Not all of it is a structural answer. Sometimes it's looking through a lens of symbolism and myth and emotions. And, so there's a lot of different ways to heal things. And certainly many of us have had healing experiences that have been non-medical, whether it's through the kindness of someone or seeing a movie or a play or reading a book, that there's many, many things that heal us. And so I'm hoping in this series to really break up your addictions to being right or addictions to being wrong, help you find what else is true, and help you see that whole keyboard so that you can solve these problems. Your vagus nerve starts in your brainstem. It's it's your 10th cranial nerve, and it comes out through the base of your skull, and it goes to the intrinsic muscles of your larynx in your throat. It innervates your heart. It innervates your digestive system. It mediates sweating. It mediates inflammation. So when you have a stress response and you get a lump in your throat and your palms are sweaty and your heart's racing and you get constipation or diarrhea, those are all vagus-mediated functions. When some of the interesting things going on in the research are in women with complete spinal cord injuries, meaning that below a particular level in their spine, they don't have any function. They can bring them to orgasm with vagus nerve stimulation. In mice, there's research going on looking at severing the vagus nerve as an alternative to gastric bypass surgery. That creates some other complications because your vagus nerve is also involved in your vitamin B12 absorption. And so I don't know that that's moved beyond mice trials at the moment, but there's really a lot of things going on to your vagus nerve, and it's a big bang for your buck thing to treat. When I have clients that have had foot and ankle issues, and I can use objective tests to kind of check the biomechanics of their big toes and their ankle joints, and I can, I never start at the ankle anymore. Very, very rarely. I would go see where their vagus nerve was compressed, because there's certain places where that's more common, and one of those is at the base of the skull. And I could really, if I release the vagus nerve at the base of their skull, their foot and ankle range of motion came back automatically. Your vagus nerve uses the same neurotransmitter that your muscles do. And I think that's why vagus nerve releases have such a really powerful effect on tight muscles and range of motion in particular. But it's a really, really high yield approach. And there's some very, very simple things that you can do, and I'm going to show you one of those today. So where your vagus nerve exits the base of your skull is an opening called your jugular foramen. And so that opening is between your occipital bone, which is the back of your head, and your temporal bone, which is the side of your head under your ear. And you can really easily grab onto your ears at a particular location. I'm going to show you how, and do a little stretch for that. Your cranial bones are not truly fused. So the part you want to grab onto is your tragus. It's not your earlobe. It's the part that if you were going to cover your ears so you didn't want to hear something, that you would press down. So it's this little tab at the front of your ear. And so if you gently take your thumb and forefinger, and you're not going to use more than a pound or two of force, but you grab the tragus of the ear. This is just the easiest way to grab onto your temporal bone. And you're going to pull straight to the side, right and left, just like you're unwrapping a piece of taffy. So I'm pulling my right hand to the right and my left hand to the left. And I'm just giving that a little stretch. This is a nice thing to do before bed. I had one client recently that I was working with online, and she was having terrible nightmares, and this technique settled down her nightmares so that she's having awful, terrifying dreams at night. If you have neck tension, this can be really helpful, because another nerve, your accessory nerve that goes to some of the muscles in your neck and your traps in the back, also comes out of the jugular foramen. So you get kind of 2-for-1 nerve decompression with that particular technique. I also have a lot of intuitive psychic medium skills that I bring into my practice. And I look at things very much on a fractal scale, that we are all fractals of the universe. We embody we are literally made of stardust. And I really like to look at that even mechanically. One of the really amazing things to me about the jugular foramen, where your vagus nerve exits the base of your skull, is that in my anatomy books, the jugular foramen is very consistently 23.5 degrees from midline, and the earth has a 23.5 degree tilt. And I think many practitioners that do vagus nerve work, I come from a little bit more of an osteopathic background with it, that releasing the jugular foramen is literally like putting somebody back on their axis. It's a really amazing technique that just seems to really do magic, but I think it's literally like putting somebody back on their axis. And I think that it's interesting that that it seems to be 23.5 degrees from the midline, when that's the Earth's tilt on its axis also. We just, as we just had the spring equinox, we are in Aries season, and in astrology, Aries rules the head. And I'm going to talk later about some very kind of the symbolism and really the code in that. I think that astrology is really code for anatomy in many ways. But anyway, we'll talk more about that as we go along. But take care of your head. You can unwrap your piece of taffy, do your little vagus nerve decompression this way. And if you really want to go do something fun, go search a video of the Laniakea supercluster, because I look at that and I think that's a vagus nerve. That really looks so cool and reminds me very much of the vagus nerve. And I think as we one of the things that is really the answer for people in chronic pain is finding your path and your purpose and meaning and what you're, really embodying what you came here to do on earth, and thinking that we're so big, that we really need to play big. A lot of the times we play too small. In a shamanic culture, they would look at a lot of the chronic diseases we have, like fibromyalgia or even schizophrenia, and really see that as your shamanic illness as the birth of a healer, that it's guiding you to transform your life. And the people that I've worked with that have really approached their situation that way have had the most profound recoveries and amazing recoveries that no doctor and most of their medical practitioners would have never seen coming. So there's one little piece to add to your keyboard, and I will be doing more videos, and see you soon.